Welcome. Jump into the Compassionate Leaders Circle podcast, where leading with love isn't just nice, it's genius. I'm Laurel Donnellan.
And I'm Daryl Brown. We'll unpack business strategies infused with empathy and action, driving both profit and purpose. Our world is ever-changing, so discover how the savvy leader wears compassion as their power suit.
It's my great honor to have a couple of the leaders here from MedZed, which is an incredible company. I'm going to have them explain what you do because it's so interesting and complex, and I probably wouldn't do it justice. But today we have Enrique Balaguer from MedZed, who is the Chief Growth Officer, and Tammy Clover. Welcome.
Thank you.
Thank you.
Now, I would like maybe Enrique to tell us what MedZed does and maybe how it came about.
Sure. So if you think about the Medicaid world, which is really where we operate, and for folks who are not familiar with Medicaid is a federal state health program targeted primarily at low-income people, and then folks with disabilities and older folks as well if they qualify. In that space, if you think there's 3 to 5% of the Medicaid population that is driving anywhere between 30 and 50% of all medical spend. So it's not a small number of people in absolute terms, but a fairly small proportion of the entire population is driving the majority or almost the majority of the spend. These folks typically have a range of unmet clinical needs. Many haven't seen a doctor in more than a year. If they need health care, they're showing up at the emergency department or not showing up at all. Almost to a person, they also have significant unmet social needs. Some are unhoused. The vast majority of those folks who are in that population are quite poor. Some are working. They may have behavioral issues. They may have substance use disorder issues. So it's sort of a toxic stew, that really prevents them from, what we're seeing is people who are just they've got a lot of problems. And so MedZed was, when we started MedZed, it was a very conscious decision. MedZed is purpose built as an organization to address the needs of that population. We didn't come at it by accident. We didn't fall into it. It's not a separate line of business for us. This is what we do for a living. Our mission says it. We are here to inspire and enable better health. And even though I don't like using the word mission driven because I think it gets overused. So I'll say we're socially entrepreneurial. We are a for-profit company. So that's we have to make a living, but we get paid, and we only get paid for helping the people we serve get better. That's it. So it's a really cool, it's sort of a really cool way to go about doing business for us. The way we do it, and Tammy will get into more detail about that, but the way we do it is, you talked about the concierge medicine at the high end. We are in effect concierge services for people who really, really need those kinds of services, but have no way of getting them. So what we do is, on one level, is not that complicated, but really hard to do. And what that is we're dealing primarily with folks who have become really disconnected from almost all kinds of organizations. They're very they're typically very distrustful of anybody who's offering them help. In many cases, appropriately so. And one of the common refrains our Community Health Navigators get when they first meet somebody is, "Why are you here? What do you want?" Well, that's where our magic happens. The fundamental part of what we do is to, aside from being able to find these folks, is then getting their trust to say, we're here to help. And then the work becomes, to continue using the concierge analogy, we really work very hands-on with each individual we serve. Some stay with us for a period of, as little as 90 days, but, some folks stay with us for a year. And the goal really is twofold. One is get them reconnected to primary care. You don't need to be going to the ED. It's really important to get them reconnected to primary care. Let's address immediate needs. So if you need food, if you need housing, if you have housing, but your housing conditions are poor, and we can help you with, and we really do it all. I mean, it could be home furnishings. It could be anything that will help alleviate, especially if you're in any kind of crisis, but the short-term needs. That's the first part of our work is getting folks the help they need. The second part, which in our view is maybe even more important, that's sort of the enabling better health. And a big part of that is to over time work with the people we serve to give them both the tools and the knowledge to be more self-reliant and start navigating the support systems that are available to them more in a more independent way. None of us are ever completely independent. We're always dependent on ourselves and other folks, but to create more self-reliance, and that's the way that you make this intervention durable. The folks that we run into folks who graduate from our programs on occasion, but for the most part, folks are end up in a much better place than when we started. And the work is really bespoke. I mean, we get asked, our clients are managed Medicaid managed care plans. Sometimes they'll come in and ask us to target some specific care gaps. We assess everybody that we touch in a comprehensive way. And so just to give you a sense, I mean, typically we're finding, on average 5 open care gaps for every person that we touch. That's a lot. Folks may be struggling with medication adherence. Folks may be struggling with, typically housing, transportation, or sort of two big gaps that we see, both of which definitely get in the way of good health. So that's a sort of a thumbnail sketch of what we do and why we do it.
Yeah, amazing. And I wasn't aware there were companies like yours around. I know you said that there are. Tammy, I'm really curious. I mean, one of my areas of study my whole career has been this idea of calling and having a calling rather than just a job. I imagine the folks that you have out there doing the work really have a calling and are very special. Could you tell us about how this works and how you're set up as a company with I don't know what you call them that are out in the field. I think you have a special name for them.
We do. Yeah. So they're called Community Health Navigators at MedZed. And basically what they are is they're the heartbeat of our organization. They're the people that are doing the outreach out in the field, getting these members to have that trust. And so what makes them special, we've hired them within the community. And sometimes they're either ingrained in the community, they have family that was within the community, or they were part of the same type of community that we're trying to serve. And so we're giving them that second chance to sort of give back. And so they have a deep, deep passion for what they're doing. They love the work they're doing and they want to help because it helps their own community and they want to feel that reward. And it is very rewarding, very hard, but very rewarding in the end. So the Community Health Navigators are compassionate. They're within the community. It's part of their soul, pretty much. And honestly, they would be doing this work whether they're with MedZed or somewhere else. The difference is that we're a better village, right? We can have a bigger impact and help them with resources to do more outreach.
And how big is your team nationwide, and what areas do you cover?
Yeah, so we're in Washington State, we're in California, New Jersey, and Maryland. And so how big is our team? The majority of our company, the highest, head count of our company are the Community Health Navigators, because they are the ones, like I said, drilling it every day and going out in the field. We're their support, but we're really there to really support their success and for them to provide the reward and put their passion into what they're doing.
And why those particular states? Are laws easier to work with, or?
No. Enrique could answer that question.
That's a great question. So they're all Medicaid expansion states, which arguably makes it a little bit easier to do the work. We really started doing this work in California, and there is a method to that. California has really been at the forefront of addressing health-related social needs. So the CalAIM initiative, which is now in its third year, has effectively included social supports in the Medicaid benefits package. So if you're in California and you're on Medicaid, in addition to being entitled to receive medical services, you're also entitled to receive a range of social and community supports as part of that benefits package. And so MedZed lives on the social support side of that, coordinating care. Other states, we expand largely through relationships that we've got with our clients, which include a combination of large national health plans and then some regional health plans. This is an expanding space. So if you look at there's a Kaiser Family Foundation just released their latest Medicaid survey a couple of days ago. 39 states currently have some requirement for their Medicaid managed care plan contractors to offer some kind of social supports. And they're sort of all over the place. So for us, the expansion is there are two sides of it. One is, again, we follow that path. The other is we get asked by our health plan partners to come into a particular market and address the needs of a particular population. So there's no sort of magic, deterministic path for this. We're going where the need is, and we're going where our customers need us to be.
Tammy, as a former HR person, I'm very curious on how you recruit these angels that are out in the field. Yeah. How do you train them, and how do you make sure that they take care of themselves while they're taking care of other people?
Yeah. So we recruit within the community. So we're looking for people that are either ingrained in the community or have some connection within the community, because that is the fastest way to build trust and be able to locate some of the members. And you heard Enrique say they have to find them sometimes. Sometimes these members are displaced. And so these people are the people that work for us. The heartbeat of those CHNs they're resilient. They'll go out there and track people down and find them. And I have stories where I did some ride-alongs and I was like completely blown away and amazed at the heart they put into it, and the actual time to get out there and not give up. And so we look for that. We are also, like, for instance, an example in California, it's about 87% of a Hispanic population. So we make sure that the CHNs that we're hiring are bilingual, that they can speak to the members and make them feel comfortable and make it more of a community based and a relationship and a partnership as they're trying to get them on that path and to stay on that path. I did the same thing within my HR department. So I hired bilingual HR business partners to make sure also that we're extending that partnership and that even our own employees are feeling that connection of community and that we're supporting them in that. And we're looking specifically for bachelor's degrees and backgrounds in public health, substance abuse, or social work. And that seems to be sort of a success factor for us of the people that are like, yes, let's go out there and do this very hard work, but crazy rewarding. And as for me, HR, I can go anywhere. I've worked at other industries, but we're drawn to this company for reasons too, right? We have our own background and reasons of why we're drawn to the company. And again, it's that service-minded and that passion for helping others and wanting to to see that amazing impact, which is actually really exciting.
Well, I'd like to shift to the personal. Like, what this is a very special company with very special work. What is the backstory for you individually that drew you to this? Like, why is this mission so important to you from a personal aspect?
Sure. Enrique, do you want me to go first or?
Yeah, go ahead.
Okay. So actually, they recruited me and found me. And when I was looking into the company and digging in, I had a personal connection. So my brother and I grew up in kind of a small town with a single mom. She became ill. And at the time, there really weren't any resources or a place like MedZed, for instance. We were far from the major city. So housing, transportation, all the things that this company provides these members were really my reality growing up. And I'm not saying that if MedZed was in our town, they could have saved my mother's life. I'm not saying that. I'm not clairvoyant. But I will tell you that I think my brother and I would have had a much smoother situation as we were, kind of growing in this environment. I think my mother would have received better care. We would have had those needs that Enrique brought up, the social aspect that we're providing. We would have had those needs, and they weren't really provided. We had to lean on various churches in the small town or different things, but it really was not like this inclusive system where it was helping my mother apply for aid and doing all those things. And one of the things about it, and I did not know this as a young child, but as I got older, I was like, these forms are long, they're cumbersome. The understanding to figure it out was long. And when you're already ill or you have something going on, it becomes unbearable. And so that obstacle becomes a complete roadblock. It's no longer, can I climb over it? So I believe that this company could have helped my upbringing. And in the end, obviously, my mother passed away. I don't think it would have helped her living, but I think it would have helped just her care in general and be more comfortable. And for me and my brother. So I joined the company happily. I've been doing HR for, I think it's my 27th year. I've worked at all different industries, including media and really fun, right? Modern organizations where you're playing ping pong. But in this organization, I feel like the passion, and I'm proud to tell my own kids, like, this is where I work and this is what the people do that I'm supporting. And I believe in it. And it like makes me, I'm excited right now. It like makes me feel joy that I'm actually working somewhere in the field that I'm doing and giving back in this way. That's my story. It makes me feel.
I can feel it. I can feel the passion. Yeah. It's beautiful. And I'm sorry about your mom. And this whole story, your whole story reminds me, in the olden days, like neighbors took care of each other. Yeah. The doctor came to your house. It feels like you're creating something that is from a time, long ago, bringing back the things that worked when communities were stronger. So thank you for your work. Yeah. Enrique, how about you?
Yeah, so no, I think everybody on the leadership team is here for similar reasons. I'm a public policy person by training, and so I spent time in the nonprofit healthcare world. It always really bugged me as I got into this space. Tammy talked about the long forms. It always really bugged me that it was so difficult for people who needed access to help to get that help. It's and it's true for everybody. It's especially true for low income working people. And so I left government, went to a nonprofit to start essentially a software tool that was TurboTax for public benefits. And the idea was that rather than someone having to go out and talk to 5 different agencies to get 5 different programs, which may actually require in-person appearances, and if you're a low-income working person, time really is money. You can't afford to take an afternoon off to go look for a benefit, which you may end up not qualifying for. So this was in the early days of the internet. The idea was then to basically create a tool that would enable not individuals, but advocacy organizations to screen folks for benefits in a holistic way, and then do what Tammy just talked about, which is to generate all of the application workflows for all of those benefits, and to explain to that person or household what they qualified for and why. And it turns out that if you gave a low-income working household a package of benefits that included earned income tax credit, food stamps, now called SNAP, maybe some child care assistance, you could boost that household's income by 55% just from having access to that package of benefits to which they're entitled to. And so we grew that. And for me, when I moved on to do other private sector corporate work and started missing that. And so it was pretty serendipitous for me. I came across MedZed through a friend of mine. This was 3 years ago, and I was really looking for something that was, for me, that was socially entrepreneurial, where I think for me, sort of at a personal level, the ability to deploy business principles to solve a public problem and then get rewarded for that by demonstrating value, because the value we're demonstrating is real. It's sort of the holy grail. But again, it's still driven by sort of that underlying passion that it just really always just made me angry that there are significant benefits available, but there's a huge gap in that people need to cross to get access to that help. So we're doing it here, and in the same way, not just through technology, but with a really tight human connection, which as you said, Laura, I mean, it's might be old school. I just say it's human, right? It's a human connection that we establish with the folks that we help. So I can't think of a better place to be hanging out.
Tammy, you've been with the company for 2 years, but I hear you've made a huge impact on the KPIs related to human resources. Can you talk about that?
Sure. So I recognized when I got here that not only is the work hard, and I went on some ride-alongs to really understand everything and the impact that they made in the field, and trying to really understand the burnout, because it is really a heavy load on someone. And so we had a pretty high turnover when I was hired, and it was at about almost 79%, which is extreme. And I was trying to figure out, what is it? They love what they do. There's so much passion. And so we started opening up avenues for them to communicate. So I started doing stay interviews and not just relying on when somebody's walking out the door and they're tired and that's where they're at. So we did stay interviews. We started doing town hall meetings. We created an email that was my voice at my MedZed. And so they were able to write ideas, concerns, but it only came to me so that they didn't feel like there would be any type of, ramification or anything like that. And so we really started listening, and not just listening, but I had said to the leadership team, the minute I start doing this, we have to take action on things and really do something. And so what came out of the gate was our training needed to be improved, and we needed to provide better mental health support, better training when it came to de-escalation, because they're going into homes and they're doing these things. So we created a training department based off of that feedback and them using their voices. And we just keep fluidly building it out and improving it. And we ended up getting down to a 36% turnover rate. And so people, I think, started feeling heard for once. And that's the biggest thing about, I feel like companies don't realize it, but it's something so small that if you really listen, a lot of the things that they need in place are not so outlandish. They're quite simple for a company to say, all right, we're going to put our heads together and make this happen. So we got it down, a huge decline on turnover, and people not just leaving, giving notice before they leave. And it's okay to have turnover. That's fine. You want people to grow and develop and move, and you hope that some people come back around or they're going to talk about you. So we're trying to create more of an alumnus feel, that feeling of like, we loved what we did. And even though I'm moving on right now, I'm going to talk about you and send you even more beautiful people, and maybe we'll come back around and see each other again. And that is the atmosphere that I've been working really hard with my team and everyone to create, is to get that atmosphere going and make sure that we're listening to them.
That's a remarkable impact you've made in a couple of years.
Yeah.
Congratulations. It's great.
Thank you.
Enrique, I'm a big fan of for-profit social impact companies. I really appreciate that, and showing other people that you can do good and make a profit. So what are the things that you measure what are your measurements for success along the way?
So for us, I think if we get asked the question, what are you guys really better at than anybody else? I would say it's finding and engaging the people we serve. So that without that, nothing else nothing else that we've talked about today can happen. So to give you some data, we reach about 50% of the people that that we're asked to go find. That's a significant number. Most of that work happens by actually going and doing on the ground work. That's Tammy's team. It's the Community Health Navigators who are knocking on doors, who know the neighborhood, who may not know the person they're looking for, but they know their cousin, and so they go talk to the cousin. That's how we do that. The second sort of really important part, the metric that we track is then enrollment. So of the people we find, how many people agree to consent to being in the program, and that number is around 80%. So it goes to this notion of how important it is to establish trust with the people that we serve. So for us, the big, again, this is separating the doing good and doing well. We have to be able to generate value for our health plan partners, and the way that we do that is the big measurable way that we do that is by reducing total cost of care. So the metrics that we typically look at are decreases in emergency department visits per 1,000 patients, and we're in the high 30s, call it between 38 and 40%. And then the other part of that is decrease in inpatient admissions. Those two travel together. There are many cases where someone shows up at the ED and that ends up turning into an unnecessary inpatient admission. So for us, watching reductions in those trends and in the way that we construct our contracts with our health plan partners typically will include will include those targets for sure, and then other KPIs. How many times a month do we have to contact someone? But again, this is it's somewhat organic because the relationship between the Community Health Navigator and the member often gets very close. That relationship just will work. We don't have if we're caring for you, you don't have a Community Health Navigator. You have your Community Health Navigator. So that person stays with you for the time that you're here with us. And there are a lot of times when we will reach out to you, even when things are going okay. It'll be like, we haven't heard from you. Is everything okay? Do you need anything? So yeah, a lot of sort of typical KPI service levels. Did we see a person within 7 days post discharge? All of those normal things, but ultimately, as I said earlier, if we are helping people get better, then you should see them showing up at their physician's office and not showing up in the emergency department. So it's both trends, right? You should see increased utilization. Their pharma costs should go up because now they're taking their meds. So those are the kinds of things that we look at.
No, I hear a huge impact on the system in a positive way. I'm also just kind of impressed with your Community Health Navigators. It sounds like they are multi-talented. They're detectives and they must build trust quickly as empathetic people. They must be pretty remarkable people. So that's amazing.
It's where everything happens. I mean, as Ken said, we're here for support, but that's where everything happens.
Yeah. So shout out to them. What are you looking forward to in the future as you grow your business and continue to flourish this cool concept? What are you looking most forward to?
impact. I think the work that we and again the we, there's a big we, so it's not just MedZed, but I think that sort of the recipe that we've developed is really geared toward being able to do this in a way that scales. So it's great to be able to help 10 people. It's better to be able to help 100 people. It's amazing to be able to help 10,000 people to be able to do that. So for us, I think getting bigger and helping more people is a sort of a primary goal. Being able to shine a light on the challenges that folks face and why it's really important to think of people in a holistic way. Healthcare for sure, super important, but there's all of this other stuff that's also super important that gets in the way of people's quality of life. So I think that part of it for us is also something that we want to do, and help people get better within the confines, right? We're not going to talk about sort of systemic change or anything like that. We are. We're living. What we do is very practical. We hope at some point, that's a separate discussion, not for here, about whether this can drive or help inform systemic change, so that that we don't have to exist, or there don't have to be as many of us. But for the time being, it's helping more people get better, more impact.
I imagine you're keeping a lot of KPIs on how you help people and what the impact is, and you're building the case for doing things differently, which can be a long-term fix.
Right. Yep. And it varies. At the end of all of this, it starts with the beginning of the conversation of a small number of people driving a big part of the cost. That's where we start seeing some of the impact is in that reduced. You're helping people get better because the utilization goes down. There's a huge social dimension to that. There's also an important economic dimension to that. So those two things travel together.
Tammy, from your vantage point, what are you looking forward to for the future?
I agree with Enrique on the impact, but I'm going to take it a little bit differently, probably because of where I come from as a career. But my hope is to just keep fluidly moving and listening to the CHNs and making our company one of the best places to work, a place where they not only feel the impact when they go and work with members, but we're having an impact on them too, and developing them and getting them to be even more engaged and to kind of grow with our company. And I think that that's something that I've been here for 2 years, and it's been a great passion of mine since I started. When I first started, like turnover and different things, I want to make sure that we're tackling things and we're listening and we're creating those pathways for our own people for their own mental health. Because again, as you've heard Enrique and I both say, this work is not simple. It's a simple concept, but the work that they're doing out in the field is exhausting. I mean, it's draining. They put their whole soul into helping people and making sure that they get on that path and stay on the path, right? So there's a lot on their shoulders of trying to build that trust, and they care so deeply. So I think from my perspective, it's also us growing as a business in that we are providing not just resources and tools, but we're providing that development and that excitement and that reward through us providing mental health support and letting them grow and giving them all the everything so that they can make this impact for themselves and their communities. So I'm going to see it a little bit, like I said, a little bit differently, but that is what I would hope. And the more people that we can help that are socioeconomically broken out in the world, that we can spread it and recognize it, and our beautiful people can have a light shine on them of what they're doing.
Yeah, if the listeners want to have a good cry, there's some amazing videos on the website at MedZed. Yeah. We'll get to the website in a few minutes. Well, I appreciate everything you're doing, and I appreciate you both as leaders doing beautiful work. We like to close our podcast with What are the life lessons you want to share with our listeners, and what are the leadership lessons? So we'll start with life. Enrique, what life lesson would you like to share with our listeners today?
Beware of certainty. Always ask yourself whenever you're starting to feel really certain about something, always ask yourself the question, what if I'm wrong? I found that very useful.
Tammy, how about you for life?
I think for the life lesson for me is that just because you're broken right now doesn't mean that you can't achieve. And just because you're in a career doesn't mean you can't pivot and do other things and come back. And we're not set, and judgment on where you are today doesn't mean there should be judgment as you're moving forward, because we can always change and climb and do different things in life. So it's something that I hope, that it gets to younger generations too, that you don't have to just do the same thing. And just because you stumbled and fell, that's all right. You can get back up and keep moving along.
There's a way out.
There's a way out.
You don't know it, may not know the solution yet, but there's a way out. Beautiful. Yeah. And Tammy, what's your leadership lesson?
My leadership lesson. So many, but I would say the primary thing for me is to listen more. And it's something that until I had a bit of a little midlife crisis, I actually left HR, went and became a school teacher, and then came back in HR. I learned that we have to listen more to what the people that are actually doing the work, what do they have to say? Listen more. Stop just leading without listening.
Beautiful. Enrique?
I would say stay in the background. Let people do what they're really good at doing, and let them screw up once in a while. That's not necessarily a bad thing, but until you're really needed, there are other things you do as a leader, but stay in the background.
It's a good place to listen too from, right? The background. Enrique, and tell us how we can learn more about you guys and all the amazing work you're doing.
Yeah, sure. You can find us online at www.mymedzed.com. So that's our website, and we target it toward individuals as well as to potential folks who may be interested in doing work with us. We're also on LinkedIn, both as individuals and as MedZed, and then the usual places, Instagram, Facebook. So you can find us there as well. And you can reach out to us if you can reach out to any of us as individually if you want to learn more.
There's a lot to learn. I'm so grateful that I got to cross paths with you today. Thank you for your time, and thank you for your beautiful work.
You're welcome. Thanks for the invitation.
And that's a heart-wrapped episode of the Compassionate Leader Circle podcast. May your compass always point to kindness.
As you navigate the world, let compassion be your North Star. Join us next time as we continue to redefine success, one heart-led decision at a time.
Lead wisely, lead with heart. You can learn more about us at compassionateleaderscircle.com.